Good afternoon and welcome to a special pre-holidays event here at Sechelt Hospital. For those of you that I have not yet met, my name is Joanna Piros. I am very proud to sit on the board of the Sechelt Hospital Foundation and also to be your MC for this special event, as well as for all our recent Med Talks, which we've been very gratified that you have joined us for those. So we wanted to kick off the holiday season in a slightly different way. Rather than sending you Christmas cards, normally we would have invited the whole community to the hospital parking lot and had music and hot drinks and companionship, but you all know where those plans went, so you know why it's not happening. So instead, we wanted to give you a little bit of an update on what this year has been like in terms of the community and the hospital, explain where the hospital's at, and I'm joined by three special guests. Jerry Latham, the VCH Director for the Sunshine Coast, Jane Macdonald, who is the Executive Director of the Sechelt Hospital Foundation, and Bob Gray, who is our Chair of the Foundation Board. So Jerry, it has been quite a year, and I'm sure you're so happy you came out of retirement for this.
Oh, Joanne, am I ever. Good afternoon, everyone. It's so lovely to be celebrating a holiday yet to happen. Thank you very much for joining us. And a special thank you to the Sechelt Hospital Foundation for sponsoring, organizing, and executing the Holiday Hearts Lighting Ceremony. It's lovely to take a moment and pause and celebrate our community and our staff and physicians here on the coast. We all need to pause once in a while. It's been a long 10 months. It's been challenging, as you know. However, the bright spot in all of this has been our community, the generosity in giving, and our Sechelt Hospital Foundation, the Sunshine Coast Healthcare Auxiliary. As you know, back in March when we started on this journey, we knew very little about COVID. And we had a lot of learning to do, and we had a lot of reacting to do. So all of a sudden, we needed things. And then all of a sudden, we had a COVID emergency fund to access, and it was fabulous. What did we use that money for? Well, first of all, we had to really expand our isolation. So we did that. We had to expand our protective equipment for staff and physicians. We did that. We had to get specialized equipment so that the ease of intubation was going to happen safely. We did that. We had to create negative pressure rooms. We did that. And the list goes on. Are we ready? Yes, we're ready. We proved not only were we prepared, but we have cared for COVID-19, and we still continue. It is still in our community. We all know that, and it will be in our community for a few months yet. Let's hope only a few months. But as we started this journey, it was a sprint. Now it's a marathon. And again, it's thanks to all of you who have helped support us along the way. One other request that I would have of you, though, we love your donations. Over the Christmas season, unfortunately, bringing food to the hospital is going to be very complicated. So send us lots of love and wishes instead. But the other wish I have is to ask you to continue to protect yourselves. And that will help us as we protect you. So remember to follow Dr. Bonnie Henry. Wash your hands, wear your mask, keep physical distance from each other, and may your Christmas be very small. May it be in your own home, and have lots of peace and joy. Thank you again. And I'm going to pass over to my good friend, Jane Macdonald, who is Executive Director of the Sechelt Hospital Foundation.
Hi, everyone. Greetings from the Hospital Foundation office, and we're all anticipating a very different holiday season this year. As both Joanna and Jerry mentioned, no Christmas cards, no rounds of cheer throughout the hospital, no cookie platters to share with the staff, and the potential for kind of just no fun. So a few of us put our heads together to dream up some new festive and very safe traditions to help keep everyone's spirits bright. And we're really excited to share some of this joy with you today and some light for the season. But before we get going here, let's take a moment to acknowledge some things that have happened this year that we're really thankful for. And we have so much to be grateful for. It's thanks to our donors that we've been able to work with VCH and been able to replace all the cardiac monitors, helped upgrade the hospital's endoscopy and ophthalmology equipment. We've hosted 9 med talks where we helped support our community's collective resilience in mental health when we all needed it. And we sincerely appreciate the community's support and their trust as we try to honor all of your philanthropic wishes. We couldn't be more honored to serve the front line who are helping hold the line for all of us. And so with that, I'll pass it on to the board chair, Bob Gray.
Thanks, Jane, and season's greetings to you all. I'm most grateful to be able to represent your Hospital Foundation Board of Directors at our lighting ceremony. My role today is actually to give thanks to all of those in our community who have made sacrifices to halt the spread as best we can. But in particular, I want to thank our wonderful doctors, nurses, medical staff, and their support teams for keeping our community safe. Secondly, a special thanks to Jerry for her tireless efforts over the last 10 months. She has just worked very, very hard on your behalf. And thirdly, a special thank you to all of our donors, and they've given their not just volunteer time, but volunteered services, gifts in kind, cookies and donuts that we can't take anymore, but money, which we've put to good use as you've heard. You may know the foundation set up that fund. We put an initial $100,000 of seed money. It was matched by the Sunshine Coast Healthcare Auxiliary and donations from the public. And we have committed and spent now all $240,000 that has come our way. It's all been put to good use. I'm pleased to say that, well, we still have, not pleased to say we have needs, but the board last week agreed to put another $50,000 in the fund to meet the ongoing needs over the next few months. Our ability to do this is directly linked to the donations that we receive from you. Your contributions help make sure that the best medicine is local. So from the foundation staff, Jane, Tracy, Emily, and John, from all of the board, we wish you the best for this holiday season and a safe and healthy 2021. Remember, in the words of Bonnie Henry, be kind, be calm, be safe. And I'll add on, I hope, and you and your families take heart and hope from our COVID hearts, or from our hearts on the hospital, soon to be lit. Come by and see them. All the best for the holiday season. And back to Joanna, please.
Thank you all. Thank you, all three of you. So what are we actually here to do? We've talked about this lighting ceremony. Become apparent to you as you start to drive down the highway past the hospital and through Sechelt, you will know exactly what we're talking about. It's 2 hearts that we are lighting up. Now, this idea happened very, very quickly and came together very quickly. So 2 hearts were built, one cut out of plywood and wrapped with cedar boughs and lights, and then another one that was welded together by the maintenance plant at the hospital. Are we looking at those now? There we go. There's the picture. So you can see the plywood heart and the people working hard there. You can see Jane Macdonald. Also, you can see Emily Kammerly from the Hospital Foundation. This is the rebar soldered and welded heart that was made by the physical plant, and that's thanks to Bryce Rudland, Clayton Walsh, and Adam Helfer. Sorry, Adam, about that. Corey Kitawaga was also the brains behind the plywood heart. This is the assembly. Oh, we're back to now decorating the plywood heart out there with the goats. Also, thanks to VACA Marketing's Lissa Nunweller, who was the art director for all of this, and Tracy Beiruti, who we don't see in the picture, was also instrumental in pulling this together. So this is the kind of project that is dreamed up one day and is executed the next, and that's kind of been the way the hospital has been this year, not just the hospital itself, but the foundation as well. We kind of stepped up to help Jerry because she was flooded with all of this generosity from the community and no way to actually deal with it. Again, we're seeing Bryce Rudland. He is the man on the hoist and he is putting up that heart. So what we're going to be doing today, there's Emily. She's smiling behind that, you can tell from her eyes. And there's Jane, not wearing a mask, but I'm sure she was distanced from everyone. There we are. The heart is going up. It's going to be beautiful. It's going to be lovely. So one of the things that we wanted to do this year is to try to bring in a local celebrity. And you may wonder why you weren't invited, but hey, here's the rationale. So far this year, there have been 151 babies born at the Sechelt Hospital. Absolutely. Can you believe that? 151 babies. But the first one born was actually born in January. So she's coming up to a year. And so we went to the Reimer household to ask almost year-old Sophia to help us light the hearts this year. Let's take a look at that.
Hi, we are the Boxall Reimers, and this is our little Sophia, who arrived at Sechelt Hospital at 10:39 p.m. on January 7th this year. She just took her first steps last week, and now she's walking. We had a great experience at Sechelt Hospital's maternity department, and we're so grateful to the nurses and doctors who helped deliver Sophia safely into this world. It's an honor to help light up the sky and the hearts at Sechelt Hospital. From our family to yours and to all the healthcare team members of the Sunshine Coast and Sechelt Hospital, we wish everyone healthy and safe holidays this year. Now let's do this. All together, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Light it up!